Hello, hi everyone. Good afternoon again. Thank you for joining us. Today is September 30th, 2024, and we begin the kickoff of our Medicare Monday program that we started last year. Can you imagine it's been a year since we started this Medicare Monday program, learning about Medicare? Rutland.
Time flies, time flies.
Time flies, and it's 2024. Get it into 2025 again. Annual enrollment period is just at the corner again, and we want to get back together as we have been learning about Medicare, learning about Medicare and all the pathways. I know it's been a year. We will take some time to go back to try to review what we have learned last year. If you have missed it, I would say at least the first three, four series are very general Medicare stuff. So you can still go back and watch the videos. They are still relevant for 2025. But as we get into 2025, we want to pivot into some of the changes that are coming in on 2025. Look at the Medicare Part D specifically, and we'll explain that. And we know there are so many different places that you could have spent your time, but you decided to spend with us. So we appreciate your time. We appreciate um, your attention. We appreciate all the things that the opportunity cost, the things that you left to join us today. And we hope that by the time of our period today and next week and the next week after, we have three sessions for this year. So as you're joining us today, we hope you join us next week and also finally join us to the last one. So we have three series, and you'll get to learn. If you have any questions, we will share our email addresses and our contact information at the end of the series. So you may please contact us. If you can watch us on YouTube, you can watch us on LinkedIn, you can watch us on Facebook. We are all over the place. So call your friends, gather your friends together so that we can learn about Medicare. My name is Dr. Prince Bewa, and I am the founder and chief tutor at the Hills Academy. And at Hills Academy, we make sure that our health system is easy and simple to understand so that you can prepare. And I'm here being joined by our dearest Ruthlyn Noel Joseph. And I'll pass on to Ruthlyn to tell us more about yourself and your organization again for our audience.
Well, hello everyone. Good evening or good afternoon, wherever you're watching us from. My name, Ruthlyn Noel Joseph. My company is called Healthways Solutions, and we specialize in Medicare. We specialize in individual health insurance, individuals, families, small groups. We work with life insurance. So we're a small boutique agency, is what I say to my team and to everyone. And we're just here, just doing our best to serve our communities
Mhm.
and help individuals to navigate healthcare in general.
Thank you so much, Ruthlyn.
You're
And
welcome.
this year we had the privilege of having another sponsoring organization, the African Immigrants Dream, which is run by our dear sister Beatrice Amo. And she is unable to join us here on the studio, but she has been with us as we prepare and get this word out and get everything together to serve the immigrant community that are in the US here. So if you are joining us, we want to say thank you, and we'll take some time, go through what we studied or what we covered last year, just a little bit of it. And we'll always advise you to or recommend you to go back, look at what we had, the videos that we had from last year. They are still very relevant because there are only the latter part that only focused on 20 to 24 specifically, but most of them were about general Medicare, general Medicare understanding, and we will really entreat you. If this is your first time joining us, you couldn't join us last year, we will say please do so. And you don't have to be 65 or get to 65, Ruthlyn, to start learning about Medicare, right?
Oh, absolutely not. In fact, you should be learning even before that so that the transition is a lot easier because you have a little bit understanding about what you're getting into.
Yeah. And also, if you're another thing, if you are even with us and you are watching from all the different sources, you will please use the chat messages. We get them here, we get them in the studio, we are able to answer them. So if you have any question on YouTube, on Facebook, on LinkedIn, please leverage the chat messages, because we get them in the studio here and we can answer your questions through that. We can see thank you Kamiduku saying thank you for joining us, and I have over here, thank you once again, and happy new year. We are sure to learn a refresher, so thank you for joining us, Kwame. And we will take the time and start digging in within the hour that we have. And please um, add questions. And if we are unable to solve it right now, we will look into it and then come back next week with answers for you. So without taking much of our time, we will go straight into getting everything going for today. So this year we want to look at, as I had described earlier, we want to look at Medicare Part D specifically. And if you are joining us, um, we talked about, and last year, right, we talked about the pathways of Medicare, right? We talked about the pathway of the traditional Medicare, and we talked about the pathway of the
Medicare Advantage.
yeah, Medicare Advantage. And sometimes we talk about the parts A, B, C, D, but Ruthlin really broke it down for us in terms of using the analogy of pathways. So you have two pathways, and within those two pathways, now we can talk about the parts. I got it right.
You got it. You got it.
Yeah. So as we look at the pathway, that Part D actually, for those that choose the fee for service or the traditional pathway, you'll have a Part D plan to it. If you choose the Medicare Advantage pathway, you still have, if it's a Medicare Advantage and Part D prescription drug. So the prescription drug plan affects all of them, right?
Right.
Affect the pathway that you are working with. It's more of how the logistics around that work, but at least it affects both of them. So this year we want to talk about the prescription drug part, which is Part D, and looking deeper into that and all the changes that are coming up for your families, for the audience that are watching us. So Ruthlin, I wouldn't spend more time. Okay, I said I wanted to look at, just as a refresher of all the videos that we were able to look at last year. And
Hmm.
for example, we had week one last year. We looked at the Medicare pathway, and we'll put the links in the chat, so that sorry, in the notes. So that if you are rewatching it, you are able to see them. So we looked at the pathways. And Ruthlin, do you mind talking just a little bit about the traditional and the Medicare Advantage pathway for us? Just as
Oh,
a
oh, absolutely. So, and I think I'm just going to do a quick overview. But basically, when individuals coming to Medicare, you go to Social Security office and you apply, and they give you your red, white, and blue Medicare card, and it says Part A and Part B on it. That is original Medicare, right? And everybody starts with original Medicare. And then they have to decide, now that I have original Medicare, what do I need to add? So basically, you're adding things to your original Medicare. And one pathway is to keep your original Medicare, add Part D prescription drug plan, and then also, maybe if you could afford it, add a Medicare supplement plan. That is original Medicare pathway.
Mhm.
But then there is another option for maybe folks who cannot afford the Medicare Advantage, or maybe they want a little bit more extra benefits, dental, vision. Maybe instead of having four plans as you do under original Medicare, you have one plan covered, providing coverage. That plan is contracted with Medicare, so the benefits are still there, but it's now being administered by a private insurance company. That is Medicare Advantage. You recognize Medicare Advantage by the types of plans. There are PPO plans, which are called Preferred Provider Organizational Plans. There are HMO plans, but you recognize them. There are some other names as well, but you recognize them by them having a PPO or an HMO.
Okay.
Original Medicare the concept is that there are no plans involved, right? The federal government is the one that's paying for your health insurance. The Medicare supplement helps you pay your out of pocket costs. That's all they do. They don't provide benefits or anything. They just help pay your out of pocket costs. That's what the supplement plans do. And they're
Okay.
very different in scope from the Advantage plans. Two pathways.
Two pathways. Okay, so more in the video from last
Right.
year, and then we went through the enrollment periods from
We went
last
through
year.
the enrollment periods.
Do you mind just jumping into some of
Okay.
just like very
And
very
I
short?
would say we have, we're starting because October 15th through December 7th is the annual election period. Some might call it the annual enrollment period, but that's, we all know it as AP. You're seeing the commercials starting probably tomorrow if you haven't seen them yet. And this is the time, the one time of the year where everyone on Medicare could make changes to their Medicare plans.
Hmm. Okay.
And now, if you've made changes and then come January, you don't like the Medicare Advantage plan that you have, Medicare offers what's called a Medicare open enrollment period that individuals could make changes to their Medicare Advantage plans, right?
Hmm. Yeah.
Maybe someone got a Medicare Advantage plans and they thought maybe the doctors were in network, and then come January the doctors are not in network and they want to change. They could make that change during that open enrollment period. It runs from January 1st through the end of March. So January 1st through March 31st.
Hmm.
Um, the general enrollment period is really looking at people who've missed their open enrollment. So maybe you turned 65 or you left your job, and you did not apply in time because you have a certain period of time to enroll in Medicare once you turn 65 or once you left your job. And you did not enroll in the during your regular open enrollment. You could use the general enrollment period, which also runs January 1st through March 31st to choose a plan. And the rules last year changed so that if you enroll in January, your coverage will start February 1st, or if you enroll in February, it'll start March 1st, and so on. Um, you no longer have to wait until July for the coverage to start. So that's a big change that came in play last year or the year before.
Huh.
Um, Everyone that's coming into Medicare for the first time when they turn 65, they have what's called an initial enrollment period. So this is your 7-month window to apply for Medicare.
And I
Um,
talk to it like a sandwich. So you have the third
and
month,
it's
third
a
month, and
sad,
then the year.
exactly. You start with your birth month. So your birth month, the first day of your birth month, that's month number one. That's
Mhm.
month number 4, technically, right? You
Yeah.
count backwards 3 months. So we're in October, and if your birthday is in October, let's say October 12th,
Hmm.
January 1 will be the month that your Medicare is turned on. So that's considered your birth month. So 3 months prior is when you would start the enrollment process for Medicare, but you actually have a 7-month window to enroll. So 3 months before your birth month, 3 months after your birth month,
And then your birth month.
plus your birth month, 7 months window to enroll in your initial enrollment period. And
Initial
then
is a
Medicare,
Roman sandwich, right?
right, right. And then Medicare have things for individuals. Maybe you turned 65 and you did not apply for Medicare. So you stayed on your employer plan, maybe. And now you're retiring, so you're coming off. You have what's called a special enrollment to enroll in Medicare now, right? This have a different window. It's an 8 month, but you tie this into when you're leaving your employer plan, so that you're not paying extra. You're tying it to when you're going to be off your employer plan, and Um, and then you count a few months backwards, 3 months backwards, you count forward as well. So that's how we structure it to make sure that individuals don't pay too early if they don't have to because the employer plan is still running.
It's still active. Yeah.
The special enrollment period is also used for certain things like weather related. Maybe the state had some kind of issue going on, and the governor declared a special enrollment. So that gives individuals other opportunities throughout the year to apply for Medicare and get the coverage that they need.
Okay.
Did I miss anyone?
No, you
Trying to
haven't.
think. Right? It's a lot, and we do a whole training on just the enrollment
Enrollment
periods
period.
because with
Yeah.
Medicare, timing
Yeah.
is important,
Yeah.
right? And if you understand the timing, you could avoid the penalties and fees, and many of them lifetime penalties. So you want to avoid those by going with the right timing and making sure you putting forward the right paperwork as well, because it's crucial that the right paperwork goes through to make sure that you're avoiding those.
Yeah. And
Hmm.
then we looked at also at the like the Enoch, which also is applicable because they are people are getting their
Right,
notices right now and the
right.
letters. And also some of the things that were pertaining to the need, your current coverage, what are your who are your providers,
Hmm.
medications and things like that. As we planned on what are things that are needed for 2024 Medicare Mondays. It was done in
Right.
2023, but for planning for 2024 Medicare Mondays.
Hmm.
Um, and as we also looked at the cost. And I think those are some of the changes that we'll be digging deeper into,
Correct.
especially starting today with the 2025.
Correct.
This
Correct.
years are moving forward.
Yes,
In
yes.
that
And I
way.
will tell you the ANOC letters, which is the annual notice of change to the Medicare plans, they started going out last week. I already got a few phone calls from my customers already over the weekend, asking me, what is this? What is happening? So there are changes coming down the pike. And you should be getting your letter now. Most people will have theirs by tomorrow, October 1st.
Huh. Okay. Okay. That's a mind. That's a reminder. That's a refresher. At least if you were here last year or you watch these videos, you at least know or have some perspective that you should be expecting these to come, and
Right.
you be ready and prepared. And that's the beauty of these things because it helps you to be ready. Like
Mhm.
you are not ready when that comes, but because you are ready to
Correct.
win in that way.
Yes, definitely use this as your guidance, your guidance document to tell you what to do for 2025. And I know a lot of folks tend to gloss over those and ignore those. This
Mhm.
is not the year to ignore those ANOC letters that you're going to get if you have Medicare. By far, not the year to do that, right?
Mm.
We're in the process of starting to make appointments with all of our Medicare clients and get them on the books, onto our calendars, so that we could review the benefit changes that they're doing and look to see if we need to change plans for them. And many people we have to.
Okay, okay, that's awesome. That's good to be proactive before you get there. Uh,
Right.
yeah. So we will go into today's session. I know it's about 20 minutes. In 2025, as I said earlier, we want to focus on some of the Part D, which is the prescription drug coverages for 2025. Want to touch a bit on Part D and then talk about some of the changes that are coming on the Part D on the prescription drug side. So we will start on that one, and I think we will start. I'll go for today. I'll go
Okay.
for today is to review the prescription drug coverages. We talked about that last year,
Yep.
and then talk about some of the changes that are coming in 2025. So we will. We Ruth already talked about it. I know enrollment period, which the timeline is here from last year. We
Mm-hmm.
have been talking through it, and the you can go to the CMS website for more. But the Part D changes in 2025. We talked about the phases, and if you, Ruthlin, you don't mind, just quickly running up
Right.
the phases, and then
Okay.
we dash
And
through.
let me tell you, the Part D phases, or one of the most difficult things that consumers, uh, and Medicare beneficiaries try to understand. It's hard to figure out because you start in one place and then you end up throughout the year with certain costs and you're wondering how it came to be. So let me take some time here to describe those phases for individuals. Um, Currently, and when I say currently, I'm referring to 2024. Um, the traditional Part D program included what's called four phases. The first phase is the deductible phase. That is the amount that someone pays first. Not
Mm-hmm.
every prescription drug plan will have a deductible. Some of them actually have zero deductible. Some of them have maybe $100 or a change in terms of deductible, but the maximum currently is 544, right?
Okay.
So 545, my excuse. So the deductible, that's the maximum for 2024. That's the deductible phase. Technically, it works. You go to the pharmacy, and usually that's applied to tier threes because prescription drug plans is
Excuse
uh,
me.
tiered out. So lower tiers, tier one, are your generic medications, your contracted medications on tier two, and then brand name drugs. And you could think of any because those are the commercials that you see. The brand name drugs are tier four and above. So on depending on the plan that you're on, the deductible for the most part is triggered when someone has a tier three medication or above, right? Once you satisfy the deductible, that's usually a couple months fill for most people if they have a high cost drug. They move into what's called the initial coverage phase. That's what happens currently. You move into the initial coverage phase. Um, Once you reach a certain limit in the initial coverage phase, you get into what's called the coverage gap, or many people call it the donut hole, right? And the coverage gap, that phase usually is where individuals get stumped because in the initial coverage phase, they might be paying $47 or $45 for their tier three prescription branded drugs, right? And
Mm-hmm.
then they go into the donut hole, and that medication price all of a sudden went up,
Hmm.
right? It goes up to 150, $200. And what's happening in the coverage gap phase is that you're paying a percentage of the cost, no longer a copay,
Okay.
right? And that's folks, it confuses folks. And I get calls every time. I know every time someone gets into the coverage gap phase because they will call me and say, Ruthlin, my cost went up. Why? And I will have to remind them that remember when we were choosing a plan, we went over the prescription benefits. And remember, I told you something about the donut hole, and I showed you on the little formulary comparison that we have when you might end up in that hole. Oh yes, 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 right. So the coverage gap is a percentage of the cost, but once you've reached the maximum of the end of the coverage gap, which currently is $8,000, you get into catastrophic coverage.
Mm-hmm.
And last year, what that changed, well, this year, what that changed to is that you have no more copays. So for
Okay.
2024, once you've reached the coverage gap limit, $8,000, or you've spent $8,000 out of pocket, excluding premiums, for your prescription drugs, you have no more copays to pay. Now, for the vast majority of people, they will never get to catastrophic
Oh.
coverage, right? It just happens. If you're on high cost drugs, maybe you get there in July that you get to the catastrophic limit. And then for the rest of the year, you have no more cost to pay for prescription drugs other than your monthly premium.
a month. So you have no co-pays and you have no co-insurance as well,
No
right?
co-pays, no co-insurance, and you've already paid the
Pay
deductible.
the
So no
deductible
more cost because you got to that $8,000 maximum. That's
maximum.
what happens this year,
Okay.
right?
Okay.
We're gonna
Yeah.
talk a little bit about what happens next year.
Next year.
'Cause I think you're gonna like that.
Yeah. Okay. Thank you so much for
You're welcome.
refreshing us on this because it's been a year. Some of our audience are not in Medicare, but at least they are learning right now to
Hmm.
get to get used to this, right? So by the time they get there, they are not surprised. Or especially for our immigrant communities, like people
Right.
like myself or yourself, like we have probably have parents or aunties or aunts and uncles that are looking up to us like, oh, that's
Help me.
Medicare thing. Can you help us understand these things? So it helps us to better serve them and direct them in the way that they can
For
potentially
sure.
go direct to professionals that they can help. So these refreshers are very helpful for us. All right. So let's go into like this year's and some of the IRA stuff that we have
Hmm.
in play for not this year, 2025, for next year.
For this, for 2025, we're saying next year, but yeah,
Yeah,
yeah, and it is next year, but we're starting this year
this
in
year.
the
Yeah,
enrollment, right?
yeah.
Um, and so the some of the bigger changes that's coming in for 2025 relates to a change in the law that happened in 2022 called the Inflation Reduction Act, right?
Okay.
It was signed by the Biden's administration. And really and it did a lot of stuff, right? Because think about what was happening that time. They were trying to stabilize the economy following COVID. So a lot of things in there, but there were some specific changes pertaining to Medicare. Today we're talking about the prescription drug changes. Next week we'll talk about the Medicare Advantage changes and the other parts of Medicare. But for prescription drugs in particular, the goal of that law was to try and lower prescription drug costs for people with Medicare.
Okay.
Um, and those changes are being phased in over several years. So right now we're in 2024 and we saw some changes come in for 2024, and now we're dealing with the changes for 2025, which we're going to be talking about on the next few slides.
Okay. Okay. Yeah. So you feel free to take us on.
Right. So the big changes currently for 2024, um, you might have noticed that if you're diabetic, that your insulin cost might have went down drastically, right? So insulin cost is capped at $35. Now, ever so often I would say that, Prince, and I would get someone tell me, well, mine's didn't go down. And here's what. If you're on a Medicare Advantage plan, well, that insulin has to be on formulary,
Hmm.
right? Because it's still a medication.
Yeah.
So if you're on a particular brand of insulin that's not on formulary for that particular carrier, under their Part D plan, or it's not on formulary for the Part D plan, the standalone Part D plan that you do have, um, you might not have seen the change. Um,
And sorry, when you say the formulary, just as a
right.
refresher, the
Okay.
plan's formulary, it
All right.
means it's part of the plan's drug or medications
List
list
of drugs
that
that they
are
offer under that plan,
offered on
right?
that plan. Okay.
Right.
Okay.
So the insurance company has to be carrying. They don't cover all meds, but they work through and they put some medications on. Remember, I talk about the tiers?
Mm-hmm.
And I say tier one, two, three, four. Some plans have five and six, but those are drugs that the insurance company contracted with the manufacturer and they're offering them to their members, right? Both
Okay.
the Part D plans and the Advantage plans. Now, if you happen to be on an insulin product that is not currently covered under the plan itself, the Part D plan that you have, then you're going to have a problem. You're going to ask, why am I not getting the $35? Because that drug is not on
The
that
list.
carrier's formulary. It
Okay.
doesn't mean they're not on another carrier, but one of the things that agents are supposed to do is check your medications, check your insulin in particular, to make sure that the plan you have, that the medications you're taking, you know how those medications are covered.
I covered on the
Yeah.
plan. Okay. Okay.
Yeah. Another big change that they incorporated last year was the no out of pocket. So the $0 out of pocket for some popular vaccines that's covered under the Part D drug plan.
Okay. And this is implemented last year that goes through this year. Pretty
Correct, correct.
we are
And
good
all
there.
of both of those will continue into 2025. But in
Right.
2025, we also have some additions
Addition.
that's coming down the pike.
Okay. Okay.
Uh,
So we have the list here, so you can feel free.
all right. So I am super excited. I'm usually not a bearer of good news. And I guess the delivery is, you know, it's in the eye of the beholder, so to speak. um, when we spoke about coverage phases before, and I said there is the deductible phase, the initial coverage phase, the coverage gap phase, which is the donut hole, and then catastrophic coverage. I also said that currently it's $8,000 is the maximum for catastrophic coverage. So in 2025, the
Hmm.
maximum amount someone will pay out of pocket for prescription drugs through the Part D program is $2,000,
Okay.
right? So
Okay. Hold
that's
on.
a $6,000 reduction. Maybe folks will say it could still go lower. I know, but it's a $6,000 reduction in out of pocket costs for 2025 for
Huh.
catastrophic coverage, right? So
Okay.
that's some
So
good news.
so that is like from the deductible, aside from the premium, from the deductible to the co-pays to
And the
the
co-insurance,
co-insurance,
right,
everything to get to that max, move from the eight
right,
thousand to
right,
now $2,000. Okay. Okay.
correct, correct. And in addition to that, that coverage gap period that I always say folks get to that cliff in that percentage goes away. So the
Huh.
donut hole goes away for 2025. It'll be no more. You won't see it. So now we have, instead of 4 phases, we're moving down to 3 phases. You're
Huh.
still going to have a deductible phase, but now the initial coverage phase is going to be $2,000.
Hmm.
And then after that, you're in catastrophic coverage, you pay nothing else.
Wow. So I'm just seeing here that from Beatrice saying that this is good news, as you had said, that you are not usually a bearer of good news, but at least conveying this information to help people, and help all of us to now better
Right,
understand what we should estimate in terms of out of pocket cost, or for the
right,
Medicare beneficiaries out of
right.
pocket cost from that perspective on the Part D. Wow. Okay.
Yeah, no, that's going to be helpful, I think, and it's going to be a popular provision next year because every plan has to provide that, right?
Huh.
$2,000 is the max you will pay, um, and so that's going to be some welcome news for the consumer because, I mean, I have consumers that's on 15, 25 different medications that they're taking, um, and the cost could get quite significant.
Wow.
And before, normally with numbers like that, they would get into the coverage gap phase. Now, the most they will pay is $2,000. Once they pay $2,000, they're done paying for the year. So if
Wow.
you're on someone who takes a lot of medications and your cost comes in currently at $5,000, the price of the drug's still the same, right? But now the most you'll pay is $2,000,
$2,000.
right?
Wow.
So that should help a lot of people who tend to get into the donut hole phase every year, year in, year out. Now they're capped at $2,000 out of pocket.
Wow. Wow. Thank you so much for helping
Mhm.
us understand this, because now at least it feels like there's been a relief. It felt like from 6,000, 8,000, sorry, to 2,000.
Right.
Like, whoa, that's some relief. All right,
Mm-hmm.
yeah.
And the coverage gap, and that will give my age, but I remember as a young advocate starting my career when Part D came out, and we had to go around and educate seniors about what the donut hole was and how much confusion that was during that time. That now goes away,
Hmm.
is a good thing as well. So now we're no longer talking about falling into the donut hole or falling over the ledge. And you're kind of struggling in that ledge while you're trying to afford coverage. So, yes, so those two things I think are welcome additions. Anyone who've worked in policy work on those should be happy about seeing those go away for 2025.
Wow. Okay.
Right,
Okay. And as we said, this is applicable for either pathways, right? If you are in traditional Medicare with a Part D, or if
right.
you are in the the Medicare Advantage pathway with a
Right.
prescription drug,
Yeah, this is
all of them
tied to
should be working.
prescription drug costs in general. So
Okay.
that's the
Okay.
most amount individuals would pay. Yes.
Okay. All right. Thank
Right.
you. All right. Tell us
Um,
more.
okay. Now Medicare also for individuals who's on the lower scale in terms of like income, they could qualify for what's called a low income subsidy. And what Medicare is doing next year is raising the limit, so more individuals could qualify for the low income subsidy. And it looks different ways in different states. But basically, what it does is that one, if you qualify for LIS, it lowers the premium that you have to pay on the on your prescription drug plan. So if the plan was $30, you might pay $5, right? So
Hmm.
that's why one of the things that we always try to do with individuals is get a sense as to where they are income wise and do our best to get them enrolled in the LIS program,
LIS.
because a lot of folks think they don't qualify when they do, first of all. So we always want to make sure that folks are checked against the LIS program. It's called Low Income Subsidy. You might hear it referred to as extra help,
Okay.
Medicare extra help. But it's something that individuals should definitely look into in terms of affording their prescription drug plan. Now, LIS is tied directly to the medication plan itself, right? So it's tied to the Part D plan in lowering the premium, and in many cases, lowering the out of pocket costs that they have as well, depending on the level they qualify for.
Okay. Okay.
All right.
And this is also to Part D
It's also
specifically.
under Part D.
Yeah.
Now, different states have different ways. So Medicare actually has an extra help application. But what I often say to folks is to check with your state program, because extra help, LIS, or extra help as it's called, it's tied back in many states to individuals qualifying for prescription assistance in
Okay.
general.
Okay.
So in the states, there might be the Medicare Savings Program. They might also have be eligible for Medicaid, which
Okay.
wipes away the cost altogether. So, and in many states as well, if you apply for Medicaid, that's an automatic qualification for extra help. So that's how Medicaid helps with the prescription. If you qualify for the Medicare Savings Program, also managed by the states, um, then you also automatically qualifies for extra help. So those are little things and little strategies that we work with to make sure that we're keeping costs down
No.
for individuals, is to help them qualify for these additional programs to help lower the cost of their medication. So it's extra help, but it's also Medicare savings and the Medicaid programs all tie back into the extra help program.
Thank
We
you
could
so
go
much.
in a whole session and just
Question on
explaining how
that.
that works, but I won't bore you with all
Yeah.
the details.
Okay, thank you so much. I just want to remind our audience, like, if you have any questions or any comments, that you can, wherever you are watching it from, either from Facebook or from LinkedIn or from YouTube, you can please put it in the chat. We will have it in the studio here and we will display it. Or if it's a question, we can do our very best to answer it. If we don't know, we can take back at it and look at it and then come back next week and follow up accordingly. So please feel free to add any questions, any comments that you have into the chat box, and we will find
Right.
to appreciate it and then talk through it. Yeah. So Ruthlin, you can take us through the other I think there's
Okay.
spread out prescription
All
costs.
right. Okay. So, and when they talk about flexibility for dual eligibles and lower and LIS, low income subsidy, dual
Mhm.
eligible, oh, dual eligibles are people who qualify for both Medicare
Okay.
and Medicaid. Right?
Okay.
They're called duals because they're qualified for both Medicare based on just qualification, and then they qualify based on income from Medicaid to help them pay for their Medicare, right? So they're dual in those sense. Currently, we for those duals and the LIS folks, we could use a special enrollment every quarter to change their plans for the first 3 quarters. So quarter one, two, and then today is the last day to change someone using the dual eligible special enrollment or the low income specialty LIS, low income subsidy um, SEP, special enrollment, too many S this year, special enrollment for an individual to make a change to a plan. You usually can't do it in the last quarter of the year, right?
Okay.
So, what happens in 2025 is that the government decided to give more flexibility. They're pulling some things. So, they're ending the quarterly
Mm-hmm.
SEP. We would use that for pretty much anyone on Medicare Advantage as well as on prescription drugs and changing the plan. They're ending that quarterly.
Okay.
But starting next year, people in a standalone prescription drug plan, they could make a change to their prescription drug plan every month.
Wow.
So it's moving to a monthly SEP that allows them to make a change. So if you're on a plan and your medications or you're having trouble with that, um, then you could use a monthly SEP next year to move into a different plan. That being said, I want to caution individuals against that.
Yeah.
One, because a lot of things could be worked out with the carrier that you're on if you ask the right questions.
Questions.
Um, but two, Medicare, just because you move to another plan doesn't mean to say that the cost that you had doesn't carry over, right? So you can't just drop a plan and think, oh, well, um, I will start over on the I want to think on the out of pocket max. Let's say like your deductibles, those are walked over to the other plan, so to speak.
Oh, all right. Hold
Right.
on.
It's the
Let
best
me
way I can explain it because it's kind of hard to grab it and capture it for an individual. But let's say you're in a plan and you have a deductible, you move to another plan, and that at, you're still going to satisfy the deductible until you're done,
until
right?
you're done. Okay,
Right.
but
Now,
does
if
it
you
does the
already
deductible refreshes or
right,
it but the deductibles may be different because you're moving
correct,
from one plan to
correct,
another, but you
correct,
still have to satisfy the deductible for that
correct,
new plan that you have
correct.
enrolled in. Okay.
Right? But now let's say you've already paid your deductible and you've satisfied it completely under the plan that you're moving in, and that other plan has a deductible. You've already satisfied the deductible for a year, but now they have to rework the numbers. So Part D is a little bit. We don't do a lot of Part D changes in a year
Okay.
because we know that the Part D system is a little bit slower
Okay.
in making sure that everything works as it's supposed to every time. But when we do have to change it. We have to warn those individuals that you're making the change and the plan is effective such and such month, but it might take a few months to see things catch up. And we've seen a lot of that this year with changes with some of the back-ended system on those Part D plans not being corrected for a few months.
Uh,
All
uh,
right. So, when individuals are trying to make that change, I like to caution them about, are there other things we could do
due to
first to make sure that the plan worked for you before really making that change?
Huh.
Right. um, and then
May I
the new
quickly touch on the first you just talked about? So this is pertaining to standalone prescription drug plans. So people that are taking the traditional Medicare pathway is what
correct.
is that have
That's
LIS
right.
is what this applies to. But if
Correct.
you're an MA, the Medicare Advantage
MAPD, right?
MAPD
Medicare
pathway,
Advantage.
this doesn't the month is does it still stay quarterly or
Um, we're gonna discuss that one next week, Prince,
okay,
because
okay,
they're doing something a little different for
okay,
the folks with Medicare Advantage. It's
okay,
slightly there's some changes there as well.
okay.
But at least for folks with the standalone prescription drug
Prescription
plan.
drug plan, you know.
Now, remember what I said. It's only for duals, right? So you have to have Medicare and Medicaid, or you have to also qualify for the low income subsidy, right?
Okay,
That's not the majority of people on Medicare, right? Most people on Medicare do not qualify for either of those programs,
yeah,
right?
okay,
So
okay.
they cannot, that monthly SEP, that monthly special enrollment, is not going to be available to the vast majority of people who have Medicare.
Yeah, okay.
Don't go and say I said you have it and you change. Now, what is most important for those individuals, though, is that whoever their broker is, or if they're working on it on their own, is that they make sure that they're checking their medications, because they are going to be locked in 2025. Other than those other special enrollments that we discussed, right? So
Mhm.
excluding the duals, SEP, or excluding the extra help, the low income subsidy SEP, most individuals will have to find a different special enrollment to make a change next year.
Okay.
Otherwise, they're going to be locked in for the entire
The
year.
entire year. Okay. Okay. Thank you so much for clarifying that. That's why I wanted to make sure that it's clear
Mm-hmm.
pertaining to who it applies to and then how that applies to. And we just
Right.
had a chat here from Daniel saying that very helpful message, and I concur to that to have that knowledge as well. Yeah.
Thank you. Thank you. And then the last thing, and I'm still trying to figure out how that is gonna work, but basically, there is a new program. It's called the Medicare Prescription Plan. And what that does is it's going to allow individuals to spread the cost of their medication when they go to the pharmacy over the
Mhm.
course of 12 months. And
Okay.
that's all I'm going to say for it. I don't think it's going to be right for everyone. And
Okay.
think about that. You're filling your medication every single month. Um, how will you make that program work? Now you're
Okay.
spreading it, your max is $2,000, right? So it's probably going to work best for people who have super high cost medications, that they know they're going to spend $2,000 for the year on those high cost meds, and they're going to take their time and pay the $2,000 on
Okay.
those meds. But it's going to spread more to come on that. Individuals will have access to it at the pharmacy counter.
Okay.
Um, and that's all I'm going to say about that one,
Okay. All right.
because it's
Okay.
yet to be
Thank
seen.
you so much for these updates and keeping us abreast on some of these updates that are coming in 2025
Hmm.
on the Part D side as such. Um, yeah, I will move to the next one. What are the things that you had put in here for consumers to
Hmm.
be prepared to watch for as they go into the 2025?
And that's why I say the ANOX, the annual notice of change that folks are getting today, probably tomorrow. You might have gotten it Friday or over the weekend. It is so important, because what those documents intended to do is to explain to you from your plan, because you're going to get it from your current Part D plan. It's going to explain, this is what you have now, and those are the changes that we're making for next year, right? So
Okay.
it's so crucial that you at least just take a look at it and see what's changing. Many plans are being eliminated,
Okay.
right? Many plans have name changes as well.
Okay.
um, some plans are moving individuals automatically. You may not have to do anything. But you want to make sure that you review those documents to see what's going to happen to yours and if you need to do something.
Okay.
Right?
Okay. So you should be expecting that from your health plan that you currently enrolled in. At least we're talking Part D.
Correct.
So, and then either is the same plan package changed, or the same plan moved into a different benefit package within the
Right.
same organization, or whatever has happened to your plan, to just make
Correct.
sure that it whatever wherever now you are, it aligns to your current need. So
Correct.
if you need to do something, pretty
Right.
much
And that's something that happens every year,
every
right?
year.
But this year, with all the changes, we want to make sure that folks don't get stuck, because sometimes you have to do something. And if they tell you you need to re-enroll in the plan, or you need to find another plan and you don't, there's a very good chance that you're going to be on Medicare in a different plan, because they might put you in a basic plan, or they may leave you without coverage,
Uh,
right? So
yeah.
you want to make sure that you're doing whatever is told of you. If you have to re-enroll, re-enroll. Don't
Okay.
just leave it to chance.
Hmm. Okay. All right.
Right? Um, and think about it too in terms of your medications, right? Carriers before 24, $8,000 was the out of pocket max. So you actually had more risk in there. Now they're lowering your risk, so to speak. Insurance is always about risk.
Yeah.
So they're lowering your risk from 8,000 to $2,000, which means that carriers are going to look at their formularies, they're going to put it all under a microscope, and they're going to look, and there might be some medications that's not covered, or may be covered this year on a tier 3 that's going to be covered on a tier 4. Things are going to juggle around, so to speak. So if it's one thing we get out of this today, is that I'm going to encourage everyone, Prince, to check their medications.
Okay.
You could check it on Medicare.gov. If you don't have an agent, talk to an agent, and let them, but check your medications to make sure that you understand for 2025 how that medication is going to be covered next year, and
Okay.
what your costs are going to be for
Okay.
Medicare, right? Keeping in mind that there might be meds that you're on now that won't be offered on your plan next year, but could be offered on a different plan. So you
Right.
do want to review those medications this year. If you do anything else, review those meds.
Okay, let me rephrase what you said. Because now the to make sure I understand, because now the total out of pocket max, which was 8,000, is now 2,000. And I think from last last year we learned about insurance being risk bearing, cost sharing process going on.
Right.
Now the risk to as an individual, as a consumer, is now moved down to 2,000. So as a plan, as a company, now they are reshuffling things to make sure that they are not bearing all the risk, right, financially.
Correct.
So move things around, things that may not necessarily make sense or even make sense to them,
Hmm.
very likely pull it around or shift things to different tier. There's something going to change.
Some things
Definitely.
are going to change. Some things are going to change. Yes.
So
And
take
they're
that. Uh-huh.
correct. And you might even see things like more formulary restrictions, right? And
Okay.
what are those? You might see more prior authorizations,
Yep.
where you have to get your doctors to sign off on a medication. You might see more step therapy, where they tell you you might have to fail first on a
Hmm.
medication before you could access that other medication, and you might be thinking, well, I'm on it already.
Yeah.
Why do I have to do that again? So you're going to see a lot more of those formulary restrictions. Folks are going to see that. Um, and it's going to be a little confusing and a little problematic and challenging for folks, but know that it's not necessarily bad. You may still get those meds, but there are different ways to get them. And you're going to go through all of that, because, you get something on one end, you're
Hmm.
going to get something else tightened on the other end, so to speak, right? So it's like a shuffling always of, you get this, but how are we going to manage more people from a carrier standpoint? How are they going to manage all these people? If everybody has $2,000 and everybody could get access to every medication, carriers have a problem,
Hmm.
right? So you're going to see a little bit more tightening, my opinion, but I know it's going to happen
Happen.
on the formularies. And so folks have to pay very close attention to the formularies. If they need a prior authorization, just go to your doctor, get the prior authorization. One of the biggest issues we have is some of the diabetes meds. You always have to get a request
Okay.
through your doctors. Just go ahead and get them right now and prepare yourselves for 2025
Uh,
coming in. As you get closer to the year, get those things in place. So January 1, you're on good footing, so to speak. You start your new plan year. You're avoiding all of those delays and hiccups and everything else that goes with formulary.
Yeah, I think adding on to it, looking at even as from an individual level, as you move into 2025, there might be some things that may have changed from your own personal side, right? And therefore, trying to make sure they are all aligned.
Correct.
And I live with a clinician here, and you you see the challenges, especially with prior auth, and just being prepared, because now you're looking at cost shifting, you're looking at your own life changes and things that are
Right.
shifting on your side, and the whole like the system, the insurance companies bearing risk and things like that. So definitely things are changing. I think
Right.
the best, which is what we are doing now, is to understanding those changes from a personal perspective, from the organizational perspective, from the health system perspective, policy perspective, and then being prepared, because the preparation, how it's always better to be prepared in that way
Correct.
than to go blindly, and then
Mhm.
in the middle of the year you get hit with something and you're like, okay, well, what is going on here? But
Correct.
at least the
Correct.
preparation helps in some way, that you can now work together with your providers, or even see which plan that you need to go. At least this is part D, so it applies to even if you're in fee for service, or the traditional
Right.
Medicare, or even if you're in Medicare Advantage
Mhm.
pathway. This applies to you. Like
Correct.
the only option is, okay, maybe you say you wouldn't take part D, but even then you have to still bear the cost because you need your
Right.
Medicare.
Right. Right.
Right? Yeah.
Um, and let me say, they always say, because you brought up a good thing where you said that you wouldn't take Part D. And the government says Part D is optional, but if you don't take it, you're going to be penalized a lifetime.
Mm.
So, really and truly, if
Hey.
you don't have coverage, prescription creditable coverage through an employer plan or some union plan or some other way that's paying your prescription, and it's creditable to Medicare prescription, then you do need Part D. And the vast majority of people are going to need Part D.
Yeah,
So, it's understanding how to work it to make it work to
for you.
your advantage.
Yeah.
And that's the problem, is that so many people don't understand how to navigate that prescription process. And they fall into the gaps where, the doctor might have given them a script. And I see that all the time. The doctor gives them a script and they take it to the pharmacy,
Mm.
right? But the plan that they're on says, no, this is not covered under pharmacy. The doctor needs to send it directly to us,
Ah.
and then we will approve it and send it send that medication out to you. So you have to understand the rules of engagements with those plans to make it work effectively for you.
For you. All right. Yeah, we
Hmm.
have a comment here from, thank you, from Reham. So thank you so much for joining us from LinkedIn.
Hmm.
And I know we have only 2 minutes left. So we want to finalize with some conclusions here, at least for our viewers and everyone that will watch it later on. If you don't mind concluding, and then we can share our
All
contact
right.
and for
Okay. And I'll make it brief. So, in conclusion, right? There's now that $2,000 cap on out-of-pocket prescription drug costs on prescription plans, right? So the Part D plan. So that's all you're gonna pay. Once you get to that, you have no more co-pays, no more co-insurances to pay, right? If it happens to you in March, that's a great thing. If you get to your $2,000 in December, then you've already went through the entire year, and that happens now. we're going to have the elimination of the donut hole, right? Which is the coverage gap phase. That goes away as well. So no one paying that percentage. You're going to pay your copays. Um, and you're going to get to that 20 to that $2,000 in the initial coverage phase. So you go initial coverage, you go deductible. If your plan offers a deductible, you'll pay the deductible. Then you get into the initial coverage phase. It caps out at $2,000. Once that caps out, you're considered to be in the catastrophic phase, and there will be no more payments in the catastrophic phase. All
Hmm.
right. The government has expanded eligibility up to 150% of the federal poverty level for individuals to qualify in what's called the extra help program or the low income subsidy programs.
Okay.
Um, there is also now a monthly special enrollment opportunity for individuals who are dually eligible, meaning that they have both Medicare and Medicaid, or for individuals who qualify for that extra help or that LIS program. So that's expanded. We have this new program. It's at the pharmacy county counter is where it's going to be triggered. But what it does is for individuals to spread the cost of their medications over a 12 months period. You're going to be working with your pharmacist and your plan, whichever Part D plan that you have, to figure out what that number is going to look like that you're going to pay on a monthly basis. Agents are totally out of that, and we're staying out of it. So, what we say is be proactive. Check your annual notice of change documents. You're gonna get those. They're coming out now. Can't say that enough. They should be there by October 1st for most plan. It should be in your mailbox. Check those. Make sure to that things aren't changing. And if there are stuff that's changing on your plans, benefits that's changing, or the name is changing, or the plan is being eliminated, then you know that you have to take some kind of action. Don't wait. You can't do anything before October 15th, but at least know that you have to make those changes come October 15th. Get enrolled in the right plan so you could avoid all of those challenges that so many folks come in January 1 and not have coverage. So we don't want you to have that. And then lastly, I would just say stay informed, be proactive. It's 2025 is going to be challenging for yourselves. The agents and brokers that you're working with, they're also challenged. We're all challenged with trying to keep up to date on all of those changes that's happening. I know I have tons of individuals that I know I have to re-enroll for next year already. So it's just a matter of just staying up to date, and just being patient. All
Okay.
right. And it should be a good year for everyone, I think. So good luck in 2025.
Thank you so much, Ruthlyn. It's always exciting to get back on this on in the studio with you. And if you have any questions, you can easily reach out to us from the Healthway Solutions email that is here, support@healthwaysolutions.com, or you can reach out to us at the info@thehealsacademy.com, and we can always correspond to submit the necessary feedback to you, either from next week when we talk about the next uh, uh, webinar review lesson that we talk about, or we can reach out to you. So please don't hesitate to reach out. And thank you for joining us, spending the hour with us. We sincerely appreciate your time, and we know that you could have done so many things, but you decided to join us to learn. And please pass this on to your friends, share with your family. And we have two more sessions. We are doing 3 sessions this year. So next week, the same time on YouTube, on Facebook, on LinkedIn at 6 p.m. Eastern Time.
Mhm.
And hope to see you. Thank you again, and bye bye for now.